life, wisdom, psyche truth, massage.
I guess you all won out for the requests, because this is Athena Jezik and I'm going to be working on Jen Hillman today. I'm going to be doing, I'm not sure quite all what. We're going to start with the face and see what happens there. See where that leads. I'll probably do a little more lymph work than massage work, and I'll explain things out as I do. So, okay, so we start out, of course, by just checking the range of motion on the neck and feeling what's happening with the occiput. And I think we'll start with a little lymphatic work because there's a little bit of fluid retention in the back of the neck. So let's just start out by draining the area. What you'll notice is if you do drain areas where there's tension or pain, you'll oftentimes find that you can get the work a little bit deeper and a little more effective by getting the fluid out of the area first. So we'll just go around opening up the neck chain. Remembering that this is a skin stretching technique. It's not like a rubbing or an effleurage. Okay, and very gently across the front of the neck. And this is not really lymph work as lymph work would go. This is more of a kind of a summary of the lymph work, just to get the fluids moving. And it's something that you'll be able to do once you have your hands a little more practice to know what you're feeling for in moving the fluid around quickly. Okay. Now I'm going to get a little bit of this lotion on. It's a lotion with some nice viscosity. It has a little bit of oil in it. You don't want to use a lot for the face. I'm going to apply that. Upward. Okay. So what I do on the face anymore with massage therapy is I just run up along the jawline, and I'm feeling the attachments along there to see if there's anything going on with them. And then of course I'm going to be adding in also a little bit of drainage when I feel anything full, especially in the water wheel. And going around the ears. Now be careful not to be too rough with the ears. I've had people grab my ears and pull them a little bit harder than what's comfortable, So be sensitive to that. Oftentimes you can get a lot of force or a lot of pressure. If you just go slowly into it, you can actually get it farther than if you go quickly. So here I'm stretching the ears. This is a little more of a cranial technique in order to also access the tentorium. But that's not our objective here. And draining the ears a little bit. So this is more of a combination of work. Going back down the neck. The neck isn't quite as full as it was when we started, so that's all good. Okay, I'm going to come up into the top of the nose and give a little bit of a cranial pull on the nasal bones, interfacing with those three bones. And you can also pull upward a little bit on the forehead, on the frontal bone, lifting up the glabella. I can feel a lot of movement happening, so there is some opening with the suture going on. Across the eyebrows and forehead. This is more of a massage type of movement, and it's not cranial and it's not lymph. And then you can go in and work the back of the head. And the same thing on the other side. And what I'm going to do here is I'm just going to put a little tiny bit of the lotion on my fingers in order to do some neck rotations and some stretching on the neck. Okay, so here as you're rotating the head, you want to follow the neck muscle right along the vertebrae. It's a little bit of a traction kind of a feel. And if you feel any kind of knotting or tension in there, you want to work the head around that so that you unwind it. Always following the body. Hurt yourself. Don't want to hurt yourself there with the earring. And there we see her neck has got a very good rotation. One more. There we go. And a nice way to start to just end the work is to give a cranial base release. It can be a small one where you're just holding the head, but just let those muscles have a chance to relax. And there are other things that you can do on the face, but primarily anything that you do that's gentle and working in an upward motion will feel good. And then a nice way to just end it is to just have your hands and just place them over the face real gently. If you have your hands tuned into something that you're feeling, you can feel the cranial rhythm in there. You can also feel if the lymphatic system is flowing in the proper direction. And you can feel the muscles if there's tension in the muscles as well. So you can hone in on that. Okay, and we can move down a little bit to the upper chest, which is a nice added thing to do with the face. And since we have already also worked the neck, so you want to just get along the clavicle and the pectoralis muscles in here. And this is just for very, very basic relaxation. I'm not going to be doing any range of motion on this. And just get that and underneath here on the trapezius and backside of this. Here's where oil is a little bit better than lotion because it stays with you. Now here I'm coming down deeper into that upper spine. I'm below C7 and just coming right up along the vertebrae. Up into the neck. Okay, there we have it.